treat high blood pressure in dialysis over the next 10 minutes or so. So I'm from Ottawa, which is the capital of Canada. I hope some of you can come here and visit Canada after the pandemic is over. Canada में सिर्फ Niagara Falls और CN Tower नहीं है, but Rocky Mountains है और and the capital city Ottawa is really pretty. And you know, this is just one of the features you can see in downtown. And right now, of course, ये season जो है, it is called fall or autumn, or all the leaves change color, they become red and yellow, and the leaves fall. So that's why it's fall, which is very nice. It gets even more beautiful with time. But anyway, back to the topic. So hypertension की बात कर रहे हैं. We are not talking about hypotension. And I'm sure you have a lecture on hypotension. I would pay far more attention to hypotension than hypertension. Hypotension is very dangerous. It is much more dangerous, and it happens far more commonly on dialysis. Hypertension is also bad. और ये जो curve है, that is from the general population. ये dialysis patients का नहीं है, but it's the same principle. कि अगर blood pressure कम है, then the risk of dying is high. और अगर blood pressure ज़्यादा है, then also the risk of dying is high in the long run. So, you know, the question है कि how do you treat? अगर blood pressure बहुत ज़्यादा है, how do you treat it during dialysis? But I would say इससे पहले बहुत सारे दूसरे questions हैं कि you know, आप सोचेंगे कि what medicine should you give? Blood pressure ज़्यादा है, मैं डेपिन दूँ या hydralazine दूँ? No, before that, you know, how high is really bad? कितना blood pressure is high? और उसका कारण क्या है, वजह क्या है high blood pressure की? But more importantly, how should you even measure the blood pressure on dialysis? And should you even measure the blood pressure on dialysis? And you should, but you should measure it more because you're worried about low blood pressure and not high blood pressure. So let's tackle those questions one by one. So ideally, you know, when we talk of blood pressure measurement, अगर आप देखो कि methods क्या है, अगर textbook में देखो कि how blood pressure should be measured, ideally the patient should be resting for 5 minutes before measuring with no talking or drinking coffee or tea or anything like that. The legs should not be crossed over. Their feet should be flat on the floor. Their arms should be supported. Cuff जो size होती है, that should be the right size. You know, the cuff size should be based on the arm circumference, and should be placed on the bare arm. या आप भी एक shirt or coat or साड़ी के ऊपर नहीं cuff रहना चाहिए. And you should not be talking. You should not be using a cell phone or reading. And ideally, blood pressure should be measured in both arms. And you should correctly check the blood pressure from the arm that is with a higher reading. लेकिन कौन करता है ऐसे blood pressure? Dialysis पे तो you know, you look at this. This is not possible. They are not sitting. They are lying down. They, you know, or usually when you are checking blood pressure, you are often when you do the pre-dialysis blood pressure, तभी you know, you're talking about their weight. कि आप कितना पानी पिए वीकेंड पे, you know, वजन बहुत ज्यादा बढ़ गया है, और you know, फिस्टुला लेके आ रहा है कोई नीडल डालने के लिए. तो it's not at all unexpected that the blood pressure will be high when all this is going on. You know, they are not feeling well because they're in the dialysis unit. They are not happy. They're lying down. So ये सब चीजों के कारण blood pressure is going to be high. It's not going to be the real blood pressure that we talk about. You know, अगर study में देखो कि अरे ये blood pressure अच्छा है, that doesn't apply when you are doing this, you know, very messy blood pressure. And that's why home blood pressure is way better than measuring dialysis blood pressure. So ये राजीव अग्रवाल है जो he's an Indian nephrologist, he's in Indiana, और उन्होंने blood pressure dialysis से सबसे ज़्यादा studies उनके हैं, and here he shows that measuring blood pressure at home is better than measuring it in dialysis. And there are many reasons why. एक हो सकता है कि white coat hypertension है, that the patient is so worried and tense and you know everything else is going on, इसलिए clinic में blood pressure ज़्यादा है, घर पे कम होगा. लेकिन कुछ patient ऐसे भी होते हैं जिनका blood pressure घर पे ज़्यादा है, so they have what we call as masked hypertension. तो आप ये miss करोगे, you know, that blood pressure seems fine अगर आप dialysis में measure कर रहे हो, but घर पे अगर blood pressure ज़्यादा है, then you're not treating it. and that's just as important. So if it is possible, tell patients to buy a blood pressure machine. उतने महंगे नहीं होते हैं आजकल, and measure blood pressure at home, और वो log रखो, and that is way more useful than you measuring it on dialysis to make decisions. मैंने फॉल का पिक्चर दिखाया, ये पार्लियामेंट हिल है, और विंटर में ऐसे होता है, इट्स ऑल ब्लैक एंड व्हाइट, देयर इज स्नो एंड आइस एवरीवेयर. इट लुक्स वेरी नाइस फ्रॉम इनसाइड द हाउस वेयर इट इज नाइस एंड वार्म. व्हेन यू गो आउटसाइड आपको कपड़े वगैरह पहनने पड़ते हैं, बट इट्स वेरी ब्यूटीफुल. It looks very, very nice. So we talked about how to measure blood pressure, but what is the cause of high blood pressure? And it's all about the weight. It's all about how much weight they have gained. And it's not about water. It's not about kitna pani piye hai. It's about salt. Agar aap namak khate ho, to you become thirsty and you drink more water. So try to focus on reducing salt intake. And if you really reduce salt intake, then the weight comes down very nicely. Or if you're able to bring the patient down to their real dry weight. काफी बार क्या होता है कि पेशेंट को क्रैम्प्स आते हैं, या ब्लड प्रेशर कम हो जाता है, या वॉमिटिंग हो रहा है, तो आप ब्लड प्रेशर कम है, that means they are too dry, or blood dry weight change karo. That's not always right. Agar blood pressure zyada hai unka at any given time, that means they have extra salt and water, and you should try to reduce their weight. Kaise weight kam karo, increase their time, bring them on more often, but those things are not as easy as I can say. But what the patient can do is to reduce their salt intake. Water intake is not the right approach. It is salt intake that matters. और हमारे पास कुछ पेशेंट who do nocturnal hemodialysis at home, so they are doing 8 hours 6 times a week. That blood pressure is completely normal. They often need no blood pressure lowering drugs. एकदम चकाचक blood pressure है with nothing, no problems at all, which tells you that it's not about medicines, it's about salt and water. और दूसरी बात है कि पेशेंट blood pressure की दवा अगर उनको चालू है, तो are they even taking their blood pressure pills, right? For example, this is a US Surgeon General who said drugs do not work if patients do not take them. And we had a patient like that, and there are many such patients. I'm sure you will know about it as well, कि दवाई लेते ही नहीं है, तो blood pressure ज़्यादा है, तो point क्या है? अगर आप if you treat the blood pressure in that 4 hours of dialysis, what is the point if that blood pressure after that is high? You need to treat their blood pressure in general over 24 hours, over their whole life, not just for those, time when they are with you. And what we did in a patient, she was on 8 medications, and blood pressure was still high, 170 over 106. So we gave her the pills. We said, okay, ये दवाई आप खा रहे हो, तो सब दे दिए उनको. So within an hour, the blood pressure dropped from 180 to 100. It's like TB जैसा direct observed therapy, वैसे direct observed therapy किया हमने. And then the blood pressure dropped. And that's an option for some patients who you doubt are not taking their blood pressure pills. Is you can give some long acting pill, perindopril, या bisoprolol, या ऐसे कोई दवा है जो 44 hours चलेगी, that you can give after dialysis also. So that is one option for some patients when you doubt whether they are taking their pills. And how high is high, right? Is it a number that is important? So there is no data ki 180, 160, 200. What is important. And the reason, of course, we worry is that as the blood pressure goes up, the risk of stroke goes up. It like linearly it goes up. So you have to decide, how high is high. And the things that are bad with high blood pressure is, stroke, lakwa ho sakta hai. It can be vision, heart attack, heart failure more than heart attacks. These things are something you're worried about. So numbers is zyada, if something else is happening, that's more important. But make sure your number is right. If the blood pressure is high, check it again. Cuff adjust karo, dekho monitor barabar chal raha hai ki nahi. It's always an opportunity to take more weight off, or thoda, namak or pani nikalo patient se. But look at the patient. Are they having any concerning symptoms? In the presence of symptoms, blood pressure number is less important. Agar kisi ka blood pressure 160 bhi hai, or unko dikhai nahi de raha hai, bahut headache ho raha hai, so that is important. If it is 180 and they're feeling fine, it is less important. So the symptoms are just as important as the number, so balance, loss of vision, agar face teda ho gaya hai, arm mein weakness hai, baat karne mein takleef ho rahi hai. So those are things that, it could be a stroke. That's more important, whether the number is, very high or high. Lastly, when it comes to the choice of medication, what should you use? You want to use something that is fast acting and short acting. मैं जब MBBS कर रहा था तब we would use sublingual depin, but it's really bad. अगर आप use करो sublingual depin, so there is more stroke, there is more heart attack, there is severe hypertension. So don't use that. Do not use sublingual depin. If it's really high, and this is just my opinion, I'm इसके लिए कोई trial नहीं है, कोई paper नहीं है, but if the blood pressure is more than 200 or 120 with no symptoms, recheck, give some rest. I only use 0.1 clonidine, or sometimes you can use 10 milligram of hydralazine and only one dose, and check it again and it will be down. Often all you have to do is let the patient rest. बात मत करो, शांति से उनको आराम करने दो, and the blood pressure will be lower. So in summary, agar summer mein aap aao, to it will be really nice. In Ottawa we have a lot of tulips, and again this is the Parliament Hill and Chateau Laurier with the river in between. So in summary, measure the blood pressure properly, encourage patients blood pressure measurement at home, not just in the dialysis unit. High blood pressure is a sign that namak zyada hai, so drive it kam karo. And check if they're taking their blood pressure pills. It's a very common problem in many patients. And treat the patient, not just a number. So with that, I'll stop here. If you have any questions, आप मुझे email कर सकते हो, या you can tweet at me at Swapnil. अगर आप podcast सुनते हो तो हमारा एक podcast है freely filtered करके, या फिर एक website nfjc.com जहाँ पे हम nephrology के काफी चीजें discuss करते हैं. Thank you.